medicine self-selects for perfectionists. So people who go into medicine are people who have achieved. You can't get into medicine without getting all A's at everything. And that is not something that just people pull out the bag. People are studying, they're giving everything, dedicating everything. There's also a culture in healthcare that doctors are superhuman. We're machines. We do not get ill. Doctors don't get ill. And it can be a culture of stigma and shame. There's a significant proportion of medical students who don't go on to even take up junior doctor jobs. That they're looking for exit strategies while they're at medical school. It became more and more clear to me that there was a real need for us to change the culture within healthcare, to prioritise looking after ourselves and to look after each other.
This is the Thinking Mind podcast. Hi everyone, and welcome back to the Thinking Mind podcast. This week I'm really excited to bring you a conversation with Dr. Helen Garr. Dr. Garr is a GP working in Nottingham, as well as being one of the medical directors for Practitioner Health. This is a free NHS service which aims to provide primary care mental health support to health and social care professionals. It's a truly fantastic service, and we talk about the kinds of common things that healthcare professionals may come in with, and we share some top tips that should be relevant for anyone's workplace. We really hope that you enjoy the podcast, and as ever, please do get in touch if you've got any questions or comments. This is the Thinking Mind podcast. Here you can access in-depth conversations all about psychology, psychiatry, psychotherapy, and self-development that everyone can enjoy. Dr. Helen Garr, welcome to the podcast today. It's such a pleasure to welcome you on.
Thank you. Thank you for having me.
Dr. Garr, you are a GP working in Nottingham, and you're also a medical director with NHS Practitioner Health. So I really hope that we can talk today about NHS Practitioner Health, perhaps giving people some practical information on how they can seek support, and hopefully just a more general discussion about what healthcare and wellbeing in the workplace means and how you think about it.
Absolutely.
I wonder if I could start by asking you, though, just a little bit about your journey to where you are now, and perhaps how you came to be interested in this area of healthcare professionals' health and wellbeing.
Of course, what a great question to start with. And I worry it might take up the whole podcast, me answering that question, because it's been quite a long and winding journey to get where I am now. So thank you for asking. So I started out actually as a psychologist. I did my undergraduate degree in psychology, and my aim and my goal was always to be a clinical psychologist. So I became interested in healthcare through that route. And in order to get onto the clinical psychology doctorate, which if there's any clinical psychologists listening will know it's incredibly competitive and incredibly difficult to get onto that career path, and you need to amass some healthcare experience. So in order to get that healthcare experience, I worked as a healthcare assistant, and then actually I trained as a nurse. And I worked as a nurse for a couple of years, and through doing that realised actually I had a real interest in medicine, and I used to go on the ward rounds with the medical students and the junior doctors, and I used to push in and answer all their questions until one day a really friendly consultant said to me, why don't you take yourself off to medical school? And it just hadn't really occurred to me before. So I went off to medical school. I did one of the first 4-year graduate courses to get into medicine. And it became very apparent to me very quickly through my work as a nurse. And I worked as a nurse all the way through medical school, actually, to fund my medical school training. But it became really apparent, especially once I started working as a junior doctor, that actually, although we are trained and we are driven to provide the best care we can for our patients, we're not always so good at caring for ourselves or caring for each other. And very sadly, over the course of my career, and I know there's lots of healthcare professionals who'll be listening to this today, and also non-healthcare professionals who will have had a similar experience. But I have lost quite a few, and like six colleagues over the course of my career to suicide. And that's devastating for that to happen to anyone, but to happen to that multiple times through a career is devastating. And that's not an unusual story in the NHS. So it became more and more clear to me that there was a real need for us to change the culture within healthcare, to prioritise looking after ourselves and to look after each other. So that's essentially how I ended up where I am today with my everything that I do, and all the work that I do is 100% driven by the need to look after healthcare staff and their well-being so they can look after their patients to the best of their abilities.
You kind of made me stop in my tracks there, because I think it's maybe not talked about enough, but yes, the toll that work can take on people's mental health, and particularly the most severe toll in terms of suicide. And I have also lost people that I knew at medical school to suicide, and it is really, really tragic. So I'm sorry for your losses and for everyone's losses who is listening.
Yeah, and equally for you. I'm sorry to hear that.
And it's one of the things that makes me so grateful that Practitioners Health exists, because it's helped me, it's helped people that I know. When I mentioned that I was recording with you, several of my either friends or colleagues were like, oh yeah, I've heard of them, or I've accessed help with them. They were amazing. So we're so grateful that you exist.
Thank you for saying that. That's really wonderful to hear that. We know that we make a difference at Practitioner Health, but it's wonderful to hear it firsthand that it's helped people.
It really has. And I think the service that you provide and the support that people can access through you is unrivaled. I wonder if you could speak about both what kind of people can reach out to you and what kind of things they might expect to happen when they get in touch.
Yeah, of course. So, and that's a really common question that people ask us. And of course, our website, which we can link to in the show notes, explains the service. And we're always happy to have people reach out to us for further information. So essentially, NHS Practitioner Health, for those who haven't heard of us, we are a free, national, confidential mental health and addiction treatment service for NHS staff. We believe we are the biggest service of our kind in the world, and we know that we make a difference. So what can people expect? And I'll come on to who can access our service in a moment, but what can people expect when they come to Practitioner Health? Well, we know the reason we exist is we know that for healthcare staff, particularly senior leaders, doctors, dentists, it can be very, very difficult to seek support, to ask for help. So we know that when somebody contacts us and reaches out, either picks up the phone or fills in the form on our website, we know that took so much bravery to do that. And we know that when somebody does that, it's probably the bravest and the hardest thing that they've done. And we exist because we know it is not as easy for the healthcare staff to access support. So often, if we take a GP, for example, it can be hard to go and see your own GP and say that you're suffering with your mental health or you want support. You may well have just been on a training course with that GP the week before. You may have gone to medical school together. You may have been at a dinner party recently. Medicine's a small world. Our paths cross frequently, and it can be very difficult to seek support. It can be very difficult to seek confidential support. There's also a culture in healthcare that doctors are superhuman. We're machines. We do not get ill. Doctors don't get ill, and it can be a culture of stigma and shame around being unwell. So Practitioner Health exists and serves to address that and to allow those healthcare staff who might not otherwise be able to seek support confidential care. So when somebody fills in the form on our website or picks up the phone and comes to us, what can they expect? Well, first of all, they can expect complete and utter confidentiality. And I really want to stress that here. If anyone's out there listening, thinking, actually, I think I could do with a bit of help, but I'm not sure, I'm a bit worried about confidentiality, or anybody's listening who knows somebody who's eligible for our service, just wants to give them a nudge. We know that reassuring about confidentiality is the most important factor. So you can expect a confidential service. And if you want to register with our service as Mickey Mouse, Mary Poppins, to come in, that's okay. You can do that. And what we find is ultimately people then build up trust, and they're happy for us to know their identity, for us to support them. So first of all, you can expect confidentiality. Second of all, and probably most important of all, you can expect love. So somebody recently wrote on social media about the team who work at Practitioner Health, excuse my language, but said the team who work at Practitioner Health really do give a crap. And I thought, actually, that's just sums us up. We really do care. Everybody who works at Practitioner Health, our doctors, our mental health nurses, our patient journey team, our ops team, everybody really does care. So you can expect love and care. And then you can expect evidence-based, gold standard mental health treatment and support. And we treat mental health and addiction at Practitioner Health. So our network of GPs, psychiatrists, mental health nurses, therapists are all there to give the tailor-made, individualized treatment for whatever's going on at that time. And the treatment that we offer ranges from, we can prescribe, we can write sick notes, and that's something perhaps we'll come on to in a little while, the importance of not feeling guilty and taking time out of work when it's needed to recover. We offer various different therapy modalities, so CBT, brief intervention psychotherapy. We have a whole network of different therapeutic and peer support groups that we can offer. And we've got 3 inpatient rehabilitation facilities across England and Scotland.
Wow.
Yes, we're big. We're big. So that's sort of us in a nutshell. You asked about who can access our service. And again, this is all on our website. As I said, we're a self-referral service for doctors, dentists and senior leaders, so band 8D and above, can all self-refer. But we also exist for all healthcare staff who, due to confidentiality reasons, cannot access care or treatment locally. So we understand the special needs of healthcare professionals with, as I said, mental illness or addiction, but our expertise lies in understanding how your role might impact on your ability to receive confidential care, how that might then impact on your work and potentially your own patients. But we work in that unique interface between health practitioners as regulated professionals and as patients with a mental illness. So we can offer additional expertise where staff are undergoing an investigation or a complaint, and mental illness may have played a part in this. So in summary, doctors, dentists, senior leaders can all self-refer, but if you are a healthcare professional in the workforce who, for reasons due to confidentiality, cannot access care or treatment locally, particularly if there's addiction or regulatory involvement, then please do self-refer to us, and we will consider your referral form and either give you the support you need or signpost you to the right organisation. And just to caveat all of that, of course, because I'm aware I'm giving you a lot of information, that is for England. We also offer a service in Scotland. We're caretaking a service in Scotland, and actually in Scotland we are available for self-referral to all regulated healthcare and social work professionals in the NHS.
Gosh.
Yes, we're a big service. Huge and busy.
And do you exist in Wales or Northern Ireland?
So unfortunately, not yet in Northern Ireland, although we are aware of the need and always looking to expand where we can, where there's need. In Wales, we have a sister service who have just rebranded as Canopy, who offer a very similar service to healthcare staff in Wales.
And I wonder, through the work that you do, have you found that there is kind of a common or a particular way in terms of, I guess, psychological patterns that healthcare workers might come in with, or a way of thinking that amongst healthcare workers that you see most commonly?
Yeah,
that seems to then cause them problems.
Yeah, absolutely. And the numbers we see are ever growing. So there is such a clear need for our specialised service out there, and the data bears that out. So we see up to 150 healthcare professionals every week self-referring to us, and actually it's pretty consistent, the things that people come to us with. So anxiety is the predominant reason for people self-referring, and we're seeing more and more, particularly post-pandemic, along with anxiety and low mood, we're seeing symptoms of burnout, symptoms consistent with trauma, post-traumatic stress disorder, people feeling overwhelmed, exhausted. But more and more, we're also seeing themes of loss. So either loss with moral injury or patient loss, but also personal loss. We see people coming who are experiencing bullying in the workforce. And of course, we see unfortunately, large numbers of people experiencing thoughts of not wanting to be here. So a third of the registration forms that we get at Practitioner Health, people are expressing suicidal thoughts. Mm-hmm. And of that third, a significant number have expressed active suicidal thoughts within the last 2 weeks before filling in the registration form. So I tell you that data, it feels really worrying, but actually I tell you that data because to stress, just so people know that we're here. It's so important that we exist, because when people come to us experiencing these things, we know that with the right support and the right care, healthcare professionals get better, and they get better very quickly. So it feels scary, and we are facing a real scary situation actually with the mental health of the workforce. But I want people to know that there's hope. And we know, and our experience on the ground tells us that with the right support from a specialised service such as ours, people get better, and they get better quickly.
You've spoken about moral injury, loss, COVID, and obviously COVID plays, I imagine, a huge part into the things like PTSD and moral injury that people are coming in with. But I'm sure it's not the whole story either. I wonder what your sense is for, what's underlying the fact that you're seeing so many more people coming through to seek support with you. What are the kinds of stories that people are giving you for why they're finding things, or why they're experiencing so many difficulties now?
Yeah, I mean, people are exhausted. The bottom line, people are exhausted. We know that the type of people who work in the NHS, we're a self-selecting group, aren't we? We take ourselves into the NHS because we care, because we're perfectionists. We give so much of ourselves to our patients in order to provide the best patient care. COVID has just amplified how much of that we've had to do. And some of the stories we've heard at Practitioner Health, the things that people have gone through working during COVID, giving their all, how sitting with people while they take their final breaths, while their family watch on FaceTime. That's unimaginable, isn't it? So some of the stories are heartbreaking that people are holding, and actually some of the stories, the trauma that we hear, the hours that people are working, working 12, 14 hours without being able to take a break, seeing people, junior doctors were telling us that they were starting their junior doctor training in a pandemic. They had no idea how that compared to normal, and their consultants were telling them that they'd seen, they were seeing more deaths in 3 months of being a junior doctor than that consultant had seen in 5 years of their career. But what happens is we then start to normalise these traumas that we're experiencing in healthcare, we normalise them. Well, this is how it is. A&E doctors who come and tell us they've been assaulted by patients. Well, we take it as part of the job. So things that we normalise or things that we just accept as part of the job, people not working in healthcare would quite rightly see as real significant trauma. So day to day, we're experiencing a lot of moral injury, and moral injuries that, not being able to provide the care we want to provide because of the situation we find ourselves in, and day-to-day trauma. So people are exhausted. We know that people are doing the jobs of 2-3 people. We know that people are leaving the profession. People are looking elsewhere. There's a significant proportion of medical students who don't go on to even take up junior doctor jobs. That they're looking for exit strategies while they're at medical school. And actually what we do know is that when people come to practitioner health, we do well at retaining people in the workforce. So people who were off sick or were thinking about leaving, we get people back into the workforce. People rediscover the joy for their work when they come through practitioner health. So I think those kind of traumas that we normalise, I don't think we should underestimate the kind of things that we're facing as healthcare professionals in the workforce. So people are exhausted, they're experiencing trauma, they're working the jobs of 2-3 people. It can be very, very difficult as well for healthcare staff to debrief, to talk about the experiences that they've had. And we're working towards that. We recognise that really helps giving people those safe spaces to talk about what's happened to them. But actually what normally happens on the ground is we go to work, we have a long shift, we see terrible things, or we work really hard, we work in really difficult situations, and we come home and we don't talk about it. We switch off because we just keep it inside. Now, I know that Ruth May and her team, they've done wonderful work. So Ruth May's our chief nurse with the Professional Nurse Advocate programme, which gives nurses the opportunity to talk about the experiences they're having in the workplace, and we know that works. And all staff at Practitioner Health also have supervision, and that's something that I personally think would be amazing if we could roll out. If I had a magic wand, that's what I would do: roll out across the workforce safe spaces, platforms, ability for healthcare staff to be able to talk about and share their experiences. And that's what people come to us at Practitioner with, and the anxiety we see is huge. And of course, we saw the clapping in COVID, which was wonderful, people feeling valued, but the clapping stopped now. And as Claire Gerarda, the founder of our service, she has written and said, we've gone from clap to slap. So it often feels that now people are almost swimming upstream when they work. The clapping stopped. People are experiencing complaints. They're working in areas where they can't provide necessarily the care that they'd want to provide. So that moral injury, that all contributes to the things that we're seeing people come to practitioner health with.
It almost sounds like from what you've said, COVID created a trauma and created a lot of exhaustion. But it seems like even though COVID is less of an issue in society more widely, the fallout of it in healthcare is still being felt because of COVID itself. But also it seems like the way that things are just in society more widely has just gotten worse for healthcare professionals since COVID. Like what you say about complaints rising, about the kind of stark contrast from people clapping on the streets to the view to discussions in the media or
absolutely. And I think we don't really know yet the impact that COVID has had. I think we're discovering that. I think it's important to know, actually, for most people who undergo trauma, that they experience post-traumatic growth rather than post-traumatic stress or distress or symptoms. So most people will experience growth, but we can't deny it was, the word unprecedented. How often did we hear that during COVID? But it really was unprecedented times. And in fact, I watched a film last night on Netflix. It's called The Bubble, and it's about Hollywood actors in a bubble making a film. And actually, even though it was only a year and a half since we were in the midst of that COVID, watching that film, which documents those times, it just feels so surreal that we lived through these times. So I think for most people, they will grow and they will move forward, but there is no doubt people are exhausted. And you absolutely hit the nail on the head when you mentioned about the complaints in the media. So I know for many doctors, particularly GPs, who are, I mean, everybody's working harder than ever. The hours that GPs are putting in, it's such a contrast to the perception that's out there in the media, and with many people in the public will often come back with this perception that GPs aren't working, they haven't gone back to work, and that's very, very difficult for a GP who is giving their all. I mean, GPs tell me that the hours they're putting in, minimum 12-hour days, crawling home at the end of the day, sometimes up to 100 patient contacts in a day. Healthcare staff have never worked so hard, but to be working so hard when the tide has turned, and actually to not get that, people recognizing how hard you're working, actually getting the opposite, that media backlash, is really very difficult. And the complaints as well, we know, I mean, we take complaints as a red flag. If somebody comes to Practitioner Health and they've had a complaint, we take that very seriously, because we know just how devastating that can be for a healthcare professional, because as we've alluded to already so far, people are working harder than ever. Nobody is going out to work in the morning thinking, I'm going to do a bad job today, I'm not going to try my hardest. Nobody's thinking that. Everybody goes out with the best intentions to provide the best care, giving their all. So when a complaint comes in, it can be devastating.
You've talked about perfectionism and anxiety, and I wonder what your kind of thoughts are, I guess, on what a complaint does to somebody in terms of their mind and how they think, and perhaps the impression that they had of themselves, and how difficult and painful it can be to try and adjust your understanding of who you are, particularly as you've come through medical school, excelling and expecting to be perfect.
Absolutely. What a great question. So, as I said, medicine self-selects for perfectionists. So people who go into medicine are people who have achieved. You can't get into medicine without getting all A's at everything. And that is not something that just people pull out the bag. People are studying, they're giving everything, dedicating everything to become a doctor. You pass your medical exams, you get into medicine, and then it's the next exams for your specialty training. You are giving everything. And so by definition, the type of people we self-select to come into medicine are perfectionists. We have to be in order to achieve to get in. So when something goes wrong, it can feel devastating. So medicine, by definition, is an uncertain profession. Things go wrong every day. But actually, when you are driven by a need to care for other people, to do your best for other people, when a complaint comes in, that really is devastating, because it shakes your entire self-worth. Somebody is coming and saying, actually, you're not, it can feel very personal. It can feel that somebody's saying, you're not very good at your job. You didn't try hard enough. You weren't good enough. That's how things can feel. Now, sometimes when there's things to be learned, when there's things that have gone wrong and we can learn from them, that makes it a little bit easier. But sometimes complaints are more nuanced. Often complaints around communication, different understandings of things. And when the complaints are more nuanced, I think that's when it's almost more devastating as a doctor, because nobody wants to feel they're not doing a good job 100% of the time. And it really can be devastating. I don't know if you've ever had a complaint, Anya, and you understand how it feels. It can play on your mind for years and years and years after you've had a complaint. Yeah, it's very difficult.
It can be very hard to kind of get your point across with it, or it can be very hard to feel like people understand the circumstances of what happened around when the complaint occurred. I guess particularly more recently with the intensities of pressures of COVID and short staffing, etc. You almost want to say to people, but you should have seen how it was. You should have seen, and I guess you can't.
Yeah. Yes, and it's difficult, isn't it? I mean, that's moral injury, isn't it? So if if somebody puts in a complaint, by definition, that person quite rightly is highlighting that they didn't feel they got their care or the service or the experience that they expect and deserve. So and actually complaints can be very helpful because they help us to learn, they help us to quality assure, they help us to develop, they help us, to make things better. So I think that's really important. Complaints are valid. And actually, if we take lessons from the airline industry, who really do look at systems and why things have gone wrong, I think we have a lot to learn from that. But where I think it's difficult for us as healthcare staff is they feel so personal. And like you say, you really want to be able to say, but I hadn't been to the toilet for 12 hours, or I was just trying my best. But actually, there's a patient on the end of this complaint who hasn't had the experience they want or deserve. And like I said, it's all about communication, isn't it? And understanding both parties' needs. But you're quite right, it isn't always appropriate to be giving that sort of response to a complaint at all. And then that can feel difficult because you feel that you're not able to justify or to explain what's going on. And I think that can be very difficult. There's some really, really great courses. Lots of the Medical Defence Organisation do really great courses on understanding how to handle complaints, which could be really helpful. And on our Practitioner Health website, we've got a brilliant page on how to handle complaints, how to understand your responses to them particularly.
Because like you say, it can feel incredibly personal. And it sounds, from what you're saying, a helpful reframe for that is perhaps to take a step back, to see the systems that were involved, but also to realise that that's a way for the patient at the end of the complaint to express what went wrong for them. And it's not necessarily about you as the professional who tried to look after them, but it is a really important thing for that patient to be able to do, to try and get some kind of resolution for themselves because they've struggled.
Yeah, absolutely. And they learning from things that go wrong is really, really valuable. And it's really important we have that culture, but learning without blame is really important.
I wonder if I could take you back to the idea of uncertainty that you mentioned a little while ago, because I guess that's something else that links in with anxiety. And just to think about it from the perspective of medical school or training for healthcare professionals, because my feeling is it isn't something that we're really prepared for in terms of the reality of medicine as a profession. And I'm not a dentist, but I imagine dentistry as well, where you just often can't know how things are going to turn out and you're making an educated guess. But it isn't something that medical school, I remember, ever telling me, and something that you kind of have to learn on the job. And as you learn it, at least my experience has been, you just terrified all the time that you're going to miss something or do something wrong.
Yeah, and that's something we hear a lot. So a common reason for people coming to us is actually they may have had a complaint or something's gone wrong or the levels of anxiety are rising, and people will come and say, I'm just terrified of something going wrong. And actually that then has effects on how we work. So people will be staying longer and longer at work, double checking. We've all done that, waking up in the middle of the night and calling the ward to say, could you just check? We've all done that, but it can become, sometimes it become pervasive, it can affect our work. So it's a really common presentation of people coming and saying, I'm so anxious, I'm double checking, I'm so worried about getting things wrong, and it's now affecting how I do things. And actually that's our bread and butter for supporting with at Practitioner Health. And I mentioned our different therapy modalities, and the CBT is really great for reframing that. And we've got some really great groups. But you're right, this is it's a brilliant skill to have, to be able to manage and hold uncertainty. And just a little plug for our Practitioner Health podcast, actually, because we cover managing all these different emotions and guilt, anger, uncertainty on our Practitioner Health podcast with my fellow medical director's aide, Anya. It's absolutely brilliant podcast to put that plug in there. But you're right, it's a skill that we learn, and I feel very strongly actually should be taught, and lots of schools are teaching this now, how to manage uncertainty. We do a lot of work at Practitioner Health with people who come to us about talking about good enough. Learning good enough, not putting pressure on ourselves to everything has to be perfect. And a really good tip I use a lot with myself, with my patients, with my children, is from the Martin Seligman PERMA model. And he talks about when you're in a difficult situation, and it's really easy to catastrophize, isn't it? So I tell a story a lot when I do keynote speeches about sort of thinking traps and thinking cognitive distortions. If my husband, he might be late home from work, and I'll give him a call and he doesn't pick up, and I'll give him a call again and he doesn't pick up, and I ring a third time and he hasn't picked up, and I'm thinking, oh my gosh, he's crashed his car, he's lying in a ditch somewhere, oh my gosh, what's happened to him, he's seriously injured, he's not going to be able to work again, I'm going to have to sell the house, I'm not going to be able to look after the kids, I'm not going to have a job. And I go into a spiral of catastrophizing when actually he's just gone to Lidl to buy a pint of milk and didn't hear his phone. And that sort of similar story might be familiar to people, this catastrophizing when we deal with uncertainty. So Martin Seligman, he talks about thinking about what's the best that could happen, the worst that could happen, and actually, given the evidence that you've got, what's the most likely thing that could happen. And I find that's a really useful tool. And our therapists within Practitioner Health, that they teach lots of skills around this. But what's the best that can happen? What's the worst that can happen? What's the most likely thing that can happen? And I think we can use that in all walks of life, because it's not just medicine where we're dealing with uncertainty. We deal with uncertainty every day. But as I said before, I think the type of people we are that come into healthcare makes dealing with uncertainty difficult, because we like to achieve. We like to be the best. It's important that things are perfect to us. So uncertainty is especially difficult for us.
And you highlighted before the point around supervision, which I imagine is perhaps a space where it can be very helpful to practice or train in dealing with uncertainty. And it's something in psychiatric training is routine.
Yeah.
But I've sometimes been really surprised from speaking to my friends from medical school who are training in other specialties, and it doesn't seem to be as routine elsewhere.
No.
And I wonder if you have a sense for, I guess, either why or if there's any thinking now so that it could be helpful to include it more widely in medical training, I guess, given what you've said about the need for it.
Yeah, and you're right. It's routine in psychiatry, it's routine for therapists. I certainly think there is a shift towards that kind of thinking and recognizing that this would be helpful. And certainly I'm seeing more and more Schwartz rounds popping up, Ballant groups, lots of in general practice Ballant groups are popping up, listening spaces, support circles, safe spaces. There's all various different platforms for them. But I certainly think there is a shift of thinking, and that's one thing that COVID has helped us to recognise, the things that will be helpful for us as healthcare staff when working in challenging situations. So I think those safe spaces are incredibly important. And as I say, I think it's if I had a magic wand, that's what I'd bring in across the NHS. It's certainly something we do with Practitioner Health patients. So I mentioned the groups that we run, and we run a whole range of psychotherapeutic and peer support groups that offer those spaces and those therapeutic interventions. And we run, just to give you a flavour of the kind of groups we run groups for managing the stresses of working in the NHS. We run a group for patients with long COVID whose mental health has been affected. We run a CBT toolkit group, managing emotions group. We run groups for healthcare staff who've got children with complex medical needs. We run suspended doctors group. We run various different addiction and rehabilitation groups. We're constantly responding to need in groups, and we offer that kind of support. There's also a wonderful charity that we work alongside called Doctors in Distress, and Doctors in Distress regularly offer for free these safe spaces to offload and talk about the situations we find ourselves in throughout the NHS for different healthcare professional staff. So Doctors in Distress is always worth keeping an eye on their website and supporting them as a charity. They're a wonderful charity. And there's lots of other charities out there doing similar things. But you're right. I think that the shift and the culture is changing to recognise the need for this, and not just formal safe spaces. I think we've shifted to recognise the need to look out for each other and to talk to each other more. It's a bit of a cliche now, isn't it? It's good to talk, but we know that is really important. So checking in on our colleagues and our teams and reaching in rather than moving from this culture of expecting people to reach out for help, reaching in. And we know that when we reach into each other and give somebody a nudge, they're more likely to seek help. So, I've noticed you've been working late. I noticed you've been coming in really early. I noticed you didn't join us for coffee. I noticed you don't quite seem yourself at the moment. Is everything okay? It is really, really powerful. So, those informal spaces to talk as well are really important.
So there's a shift towards recognizing these things, and you were talking about Balint groups becoming more popular. And I guess Balint groups started in GP, right?
Yeah.
So they're sort of, and so I guess this gets me like a reflective group where people can talk with professionals to patients. And so I've just had a little bit of training in group therapy. The thing that was addressed in that is that a lot of people think about group as, if they're offered it, they think that's sort of second best. And I wonder if you could talk a bit about why groups are really important, given that that's something that you offer, and actually what makes them special as opposed to individual support that sometimes people might instinctively think.
Yes, and you're right, and that's something that we do a lot of work on in practitioner health, because you're absolutely right. People will often want the individual support, and I think that's partly, as healthcare professionals, that the stigma and the shame that I mentioned at the beginning about sharing how we feel, and if we're not feeling, if our mental health is affected or we're not feeling at our best, there is stigma and shame associated with that, and sharing that. People are worried about sharing that. What we do know is, and you're absolutely right, people see groups as second best often. What we do know is that when we get people into groups, the power of the group is exponential. So people sharing their experiences is so powerful. So to be able to hear, gosh, I'm not alone. I'm not the only person who feels like that. But also people sharing their experiences, people who might be further down the line than you are, to give hope that things can get better, to learn from each other. But the power of the group is so important. And that translates not just in the therapeutic space, but also in the workplace. So we talk a lot about the power of teams. So Neil Greenberg, who's a really great expert in this area, and he did a lot of work with the NHS about how we can be psychologically supported during COVID. He talks about strengthening those team bonds and those social bonds within teams as being one of the most important things we can do to protect our psychological health. And I think that's almost on a parallel to the power of groups. So on the ground, how do you strengthen those team bonds? How do you find out about what we call secondary stresses, what's going on in people's lives? So often if people aren't coping well at work, it's not always work that's doing that, it's something else at home that's tipped them over the edge. People can carry their metaphorical backpack. It can be full. They can just manage at work, but it just takes a sick child, or the dog needs to go to the vet, or you're struggling to pay your bills, or the boiler's broken, and that can be the thing that tips you over, that your backpack's overflowing then. And when we know about that stuff, when we know with our colleagues and in our teams, when we know they've got stuff going on, we're much more supportive, we're much more understanding. So I think the power of groups in a therapeutic environment is very, very important, but also the power of strengthening our team bonds in our workplace is really important. So I say, on the most basic level, talk to your colleagues, find out about your colleagues. Can you genuinely name your colleagues' children? Do you know where they go on holiday? Do you know what they like to do at the weekend? Be interested in each other. Be curious. Strengthen those bonds. And when you do have a conversation with a colleague, how great do you feel afterwards when you've had a little chat? And they're the things that psychologically protect us when we're working in difficult times. So I often start a lot of my meetings with, ask my team, what did you have for your tea last night? And people laugh at me, but it's wonderful because the stories that come out from such a simple question, what did you have for tea last night? We're just sharing stories, and it's just that connection is so important.
And I think often you just feel like you're rushed off your feet, you haven't got time. But actually, just that moment of connection, that few minutes of, even if you're not getting a cup of tea, but you've just stopped and smiled and said hello, and, someone's been interested in you and you've been interested in them.
Yes, that connection is just so important, and particularly with many of us working from home, it can be easy to lose that connection. So, online meetings, just straight into the meeting, actually take a few minutes just to, how is everyone? What's everyone up to? Or how was your evening? Just connecting can be so important. And the same in the workplace and hospitals. Lots of people are adopting sort of huddles in the morning to check in with each other. Something the airline industry does routinely, check-ins before work. And there's various ways to do this. The military look at red, amber, green checklists. Where are people today? Are you red, you amber, you're green? So checking in with our teams, but checking in with ourselves is also really important. But just strengthening those social connections. And one consultant told me he takes his team out every Friday. They call it a frothy Friday. He takes the team for a coffee. It costs him 12 quid. But it's the best £12 he spends every week. As they go for a coffee, they connect, they get to know each other. And that's what's so important. And actually, all of if you look at the studies in positive psychology, so people who are happy, the one thing that happy people have in common is if they have strong social connections. So you do not find somebody who is happy who doesn't have social connections, who doesn't connect with people. So talk to your team, talk to people you don't have to, talk to people on the supermarket checkout, talk to the bus driver, talk to somebody in the workplace you wouldn't normally talk to. Pick up the phone instead of sending an email. But give people a warning if you're going to do that. I called one of my team this morning and she said, I really worry when you phone because I think when the boss is calling, it means I've done something wrong. So I've had to put the word out now. If I'm calling you, it's not because you've done anything wrong. It's just to strengthen, just have a chat instead of sending an email. So, yeah. Just strengthen those connections. And I've gone into that. You asked me about the power of groups, therapeutic groups, but I think it's important, the underlying things behind that is the sharing and the connection, and then knowing that you're not alone. So that translates into the workplace.
And this kind of links with what you're saying, and I know we only have a few minutes left, but I wonder if you could share a few words on this, because I think one of the pieces of advice that I've read you give, which I really loved because I think it's so common in healthcare, is around surrounding yourself with juicy strawberries.
Yes.
And I wonder if you could speak about what that's about.
Oh, of course I can. Oh, how wonderful that you've picked that up. So there's a theory called emotional contagion theory, which is essentially, in scientific terms, however we behave, our emotions leak out. People will mimic, they will pick up, and they will copy our emotions. So if you go to work in the morning, and so this term mood hoover, or say the Dementors from Harry Potter, if you go to work and you're a mood hoover or a Dementor, that kind of negativity, it will leak out. And actually, it's really important that we have spaces to be able to vent and talk about, we don't want this artificial harmony or positive toxicity. People do need to be able to talk about when things aren't going well, and people do need to be able to have a bit of a moan. But it can be really easy to fall into this negative downward spiral. And if we surround ourselves with negative people, we get sucked into that. So it's a bit like when you have a punnet of juicy strawberries. So you've got this beautiful punnet of red, juicy strawberries, But if there's one strawberry in the punnet that's moldy, very quickly the whole punnet will go moldy. So just as we have a negative downward spiral, we can very quickly change our environment to a positive upward spiral by smiling, being cheery, being positive. So just try it at work. Just when you feel we all have it. I certainly have a tendency to moan when we're tired, but we can change the environment. We can change how people feel. We can make people feel like juicy strawberries. So concentrate on where you're spending your time. We spend our time with the same, I think it's about 3 or 4 people, 80% of our time with the same 3 or 4 people. So spend your time with the people who energize you, the people who make you feel great about yourself, the people who lift you up. Identify who those people are. They're your juicy strawberries, and spend your time with them. So I'll just give you an example. Claire Gerarda, whose job I've taken over with my fellow medical director. Claire is one of those people. I can be feeling like I'm having the worst day in the world. I'm the worst doctor in the world. I'm the worst medical director in the world. And I can speak to Claire, and within 60 seconds I think, I am fantastic, I am great at my job, I can do this, because she lifts you. She's a juicy strawberry. She makes you feel amazing. So I learned from that. So we can all be juicy strawberries, and surround yourself with juicy strawberries.
What a point to end on. Dr. Garr, thank you so much for joining us today. If people want to hear more from you or read more from you, I know you've mentioned your podcast, which we can link to, but is there anything else you'd like us to point people towards?
So I'm really happy to continue the conversation with anybody who'd like to speak to me. My email's helengarr@nhs.net, or I can be contacted through the NHS Practitioner Health website, and I am on Twitter as Dr. Helen Garr. Amazing.
Thank you so much for your time. It's been amazing to learn from you, and thank you again for everything that you do with Practitioner Health. It's a really, really beautiful and amazing service. So thank you.
Thank you so much, Anya.
If you enjoyed today's podcast, we'd love it if you share it with a friend, or you could give us a rating on Apple Podcasts, Spotify, or wherever you listen. If you fancy it, you can even buy us a coffee to support the team, and the links for that will be in the show notes. Thanks for listening.